When someone in your family isn't feeling well,
It changes everything.
and it never happens at a good time.
That's why we're here, Monday through Saturday, 10 to 7.
And on Sunday from 11 to 5.
The clinic at Walmart, operated by St. Vincent.
No appointments. Just stop by if you're in the store or in the neighborhood.
Quality health care for the whole family.
Affordable family care.
On your schedule, 7 days a week. The clinic at Walmart, operated by St. Vincent.
All right, welcome back, everybody. It is good to have Dr. Ken Taylor here in the studio, 1-866-GMA Talk, to answer some questions about pregnancy, because you always get a lot of questions.
Yes, always.
Especially from first-time moms, I would think.
Yes.
All right. Well, we've got some folks on the line, and they have some questions for you. So we're going to start off with Carrie. She's right here in Little Rock. Hi, Carrie.
Hi.
Hi. What's your question for the doctor?
I've got a couple of questions. My first one is I'm having a hard time getting enough protein. Meat's just kind of gross to me right now. And so I wondered if a drink like Ensure or Boost is something that is appropriate.
Yes, actually it's very appropriate. Some of those nutritional support drinks, often used by like the elderly and those folks, are excellent sources of protein, and they're very well balanced, and we use those a lot in supplements for patients that just aren't quite getting enough protein or nutrition in their diet. So those are fine.
Okay, what about this, her saying meat just doesn't sound good to me? Have you heard that before?
Oh, very common. I mean, a woman's taste in pregnancy just goes all across the board, and their favorite things suddenly become their most hated things, and vice versa. And you just have to look at what you can enjoy and still try to make it palatable, but get good nutrition. And there's a lot of sources for just on good nutrition in pregnancy.
Okay, Carrie, are you still on the line? Do you have another question?
Yes.
Okay, go ahead.
And my other question is, I've had a couple of problems with bleeding, kind of associated with extra physical activity and getting overheated. Baby's still fine, but what can cause that?
Okay.
Usually, bleeding from exertion is usually just from the tip of the cervix, where it bleeds very easily, like you might if you're having a pap smear. And it is not really a sign of any kind of danger. Although as far as heavy exertion, there are some guidelines for that in pregnancy. You shouldn't get overheated, which you just mentioned. You can sweat, but don't truly get overheated. That's not a good thing in pregnancy. Maintain a heart rate of no more than about 140, maximum 150 beats a minute. But other than that, moderate exercise is good for you.
Okay, sounds like Carrie's taking pretty good care of herself.
I think so too.
Okay, thanks, Carrie. Let's get to Jamaica, who's on the line. She's in Russellville. Hi, Jamaica.
Hi.
Hi, go right ahead.
I just found out a couple of weeks ago that I was pregnant, and before I found out, I was taking Tylenol PM at least 3 to 4 times a week to help me sleep and to help with headaches before I went to bed. And since I found out that I was pregnant, I've quit taking them, but I have like massive, severe headaches, and I do not know what it's associated with. And I'm worried that the Tylenol PM will have any effect on my pregnancy, and what can I do to get rid of the headaches?
Okay.
Okay.
Well, 2 questions, but first off, Tylenol PM is just a mixture of Tylenol and Benadryl. And Benadryl, we feel, is a safe antihistamine in pregnancy. And so it's really not a problem. I wouldn't want somebody doing it just every day. Minimize whatever drugs, but it can be used as a mild sedative in pregnancy rather safely. And so that's not a problem that Jamaica's been taking that.
Good.
As far as the headaches, that's a real bugaboo in pregnancy. It's very common. They're usually tension headaches. Tylenol in the usual doses is perfectly safe for headaches. And then just physical things, you know, neck massages. It's usually muscle tension, so ice packs, that kind of thing. But Tylenol is our drug of choice.
Okay, very good. And it's something very common to have those. Okay, give us a call if you have any other questions. In the meantime, we have just a few minutes maybe to talk about what are some of the questions you get asked most.
Well, a common one is, should I or should I not eat fish? And it's a good question because there's both good and bad to it. There's a lot of good things in fish, particularly what is now a lot of women understanding is called DHA. It's one of the fatty acids that, at least we think, improves neurodevelopment, brain development, eye development. But then there's the downside of all the mercury in some of the ocean-going fish. And so the general recommendations are not to eat certain fish, and that would be the fish really at the top of the food chain. The king mackerels, the swordfish, shark, and something I'd never even seen called tilefish. It must be popular somewhere.
Yeah.
But then the better fish would be salmon, certainly canned white tuna is fine, shrimp, trout, snapper, and then there's also good online sources where you can go to see how much mercury content is in various fish. But fish is good. A couple of servings a week, though, would probably be the max.
Maybe don't overdo that as well. Okay, I think we have one more caller. We're going to get Mary on the line. She's from Little Rock. Hi, Mary.
Hi.
Hi. Go ahead.
I'm really calling about my daughter. She had a miscarriage in May, and she hasn't had a period since then.
Okay.
Okay.
And that's the issue. Okay. Well, first off, I don't know what her cycles were like before she got pregnant, and certainly if she was somewhat irregular, she'd go back to being irregular. But it's not uncommon after pregnancy not to have a period for 2 to 3 cycles, 2 to 3 months.
Okay.
If it goes on much longer than that, it's still usually not a big health issue, but she could go to her physician who could check a couple of things out and then give her something that would probably get her started in cycling back again.
So
but it's not a sign of anything bad wrong.
Good,
or anything
good.
like that.
But if it continues, maybe go check with your gynecologist.
Perfect.
And find out more. Okay, great questions and answers and information today. Let's put up the information for you, of course. Dr. Taylor with St. Vincent, but also the Women's Clinic on University. There's the information if you'd like to call. You think you need to make an appointment and get checked out. If you are pregnant, certainly make an appointment with your doctor and call the Women's Clinic if you don't have a doctor. Thank you so much. This was very informative. We appreciate it. Always good to kind of break some of those myths that we've heard about.